Intellectual disability, or ID, affects between 1 and 3% of the world population, with Down syndrome being the most common, affecting more than 5 million people worldwide. This population faces problems in communication and social skills with a risk of being poorly integrated into society. An article published in April of 2021 titled "Eliminating the Gap Between the Use of Assistive Technologies and the Inclusion of People with Intellectual Disabilities in Leisure Activities" left me with a few questions. What about the gap in healthcare for those with ID? And what about the severe patients in this spectrum that are nonverbal or aggressive? Upon my search for research in this area, I found an article titled "The Development of an Interoperable Integrated Care Service Architecture for Intellectual Disability Services, an Irish case study." Unfortunately, this study was published in a book that had to be bought. This led me to search for other current research in this area. I found an article published in February of 2021 titled "Racial and Ethnic Disparities and Perceived Barriers to Healthcare Among U.S. Adults with Intellectual and Developmental Disabilities." This article discusses the barriers to healthcare access and the need for providers and healthcare professionals to develop trust with this population. I then went to our school library database to find more relevant research. From the research, we can gather that individuals with developmental or intellectual disabilities remain the most vulnerable patients in healthcare and face numerous barriers. A comprehensive literature review is published that identified 28 studies which were published between 2005 and 2017. The thematic analysis of the included articles resulted in identifying 6 major barriers with this population. Number 1 being communication skill, followed by patient engagement and satisfaction, then training education for clients with IDD, attitude and knowledge of healthcare providers, clients with IDD being excluded from health promotion and research, and the quality of accessing healthcare services. The literature review then states that this will assist with further research on health interventions for IDD clients using healthcare technology. A more recent publication concluded that more studies of a longitudinal nature are needed to determine the long-term effects of community-based healthcare interventions. These evaluations will provide valuable information on the impact of improved health, access to healthcare services, and quality of life of persons with IDD. It will also give insight into the effects on the healthcare system. Preventative healthcare, as opposed to reactive, should reduce the need for expensive medical interventions and/or hospital admissions, which will ultimately result in cost savings for the healthcare system. Only comprehensive longitudinal evaluations will support this hypothesis, stated that author. To facilitate uptake and ensure evidence-based care is available to improve the health, well-being, and quality of life in persons with IDD, information about effective policies, programs, and initiatives must be accessible to stakeholders and family in user-friendly language. In March of 2021, a study was conducted titled "From Premise to Practice: Applicability of a Consensus Statement for Supporting Adults with IDD Who Are Frail." The results included the recommendations of improvement and maintenance are viable goals, and intersectoral collaboration is needed, which means that we need to collaborate with education, social services, and healthcare. In an article titled "Improving Healthcare for People with IDD," the author states the need for promoting formal education that guides care for people with IDD across all healthcare professions. The author also states that institutional changes will have the greatest impact on these clients' experiences. There is abundant evidence that people with IDD are underserved by our healthcare system. Patients with IDD have significantly fewer visits to not only their primary health care provider, but specialists as well. People with IDD are at a higher risk of mental illness and overall poorer health outcomes. This leads to increased emergency room visits, which result in higher healthcare costs, most commonly being paid by state Medicaid. In this technology age era, what are we doing for this population to adjust this disparity in healthcare? How can we use informatics to improve healthcare for those with IDD? I believe these questions are worth investigating. Do you agree?